The connection between mindfulness and chronic pain relief. Chronic pain is a widespread, often debilitating condition that affects millions globally, diminishing quality of life and emotional well-being. While conventional treatments like medication, physical therapy, and surgery can provide relief, many individuals continue to suffer from persistent pain. Over the last few decades, mindfulness has gained traction as a complementary therapy in managing chronic pain. It doesn't aim to directly eliminate pain, but offers a powerful means of transforming the way pain is perceived, providing both physical and emotional relief. What is chronic pain? Chronic pain is typically defined as pain that lasts longer than 3 to 6 months, extending beyond the normal healing process. It can manifest in various forms, such as headaches, joint pain, backaches, or neuropathy, and is often linked to conditions like arthritis, fibromyalgia, or past injuries. What makes chronic pain particularly complex is that it isn't solely a physical phenomenon. It has deep emotional and psychological implications. Physically, chronic pain results from persistent inflammation, nerve damage, or other unresolved injuries. However, the brain plays a significant role in amplifying or dampening pain signals. This leads to the phenomenon of central sensitization, where the nervous system becomes overly sensitive and even normal stimuli are perceived as painful. Psychological factors, such as stress, anxiety, and depression, often accompany chronic pain, further intensifying the sensation. Understanding mindfulness, a new approach to pain management. Mindfulness is an ancient practice rooted in Buddhist meditation, though it has been adapted into secular forms in modern psychology. At its core, mindfulness involves paying full attention to the present moment, intentionally and non-judgmentally. Instead of being swept away by thoughts of the past or future, mindfulness encourages individuals to fully experience the here and now. For people with chronic pain, mindfulness offers a radical shift in how pain is approached. Instead of trying to resist or eliminate pain, actions that often increase suffering, mindfulness encourages an attitude of acceptance. This acceptance doesn't mean passively enduring the pain. Rather, it entails acknowledging the pain without adding extra layers of emotional suffering. How mindfulness changes the experience of pain. To understand the connection between mindfulness and pain relief, it's crucial to explore how the brain processes pain. Pain is not just a sensory experience, it is deeply influenced by psychological, emotional, and cognitive factors. When pain signals travel to the brain, they are processed in regions responsible for not just sensation, but also for emotions, memory, and decision-making. This complex interplay explains why two people with the same physical injury can have vastly different pain experiences. When individuals experience chronic pain, they often become caught in a cycle of pain catastrophizing. This term describes a mental process where individuals anticipate that their pain will worsen, focus obsessively on it, and interpret the sensation as overwhelmingly negative. Over time, this pattern magnifies the overall experience of pain. The brain becomes hypervigilant, continuously scanning the body for any sign of discomfort, which can make pain feel more intense and pervasive than it actually is. Mindfulness disrupts this cycle by teaching individuals to observe pain in a non-reactive way. Instead of fighting against the pain or labeling it as bad, mindfulness encourages patients to explore the sensation with curiosity. This shift in perspective can dramatically reduce the emotional suffering tied to pain. Neurobiological effects of mindfulness on pain. Research has demonstrated that mindfulness can lead to measurable changes in brain activity, particularly in areas associated with pain processing, attention, and emotional regulation. Functional MRI studies reveal that individuals who practice mindfulness regularly show less activation in regions of the brain responsible for pain perception, such as the primary somatosensory cortex. Simultaneously, there is increased activation in areas associated with emotional regulation and cognitive control, such as the prefrontal cortex. Mindfulness also modulates the activity of the brain's default mode network, DMN, a network of brain regions that becomes active when the mind is at rest and tends to wander. The DMN is implicated in self-referential thinking, such as ruminating on the past or worrying about the future, both of which can exacerbate chronic pain. By quieting this network, mindfulness helps individuals focus more on present moment experiences, including physical sensations, without the added emotional narrative. In addition to altering brain activity, mindfulness can also influence the body's hormonal and immune responses. Studies suggest that regular mindfulness practice can reduce levels of cortisol, the stress hormone, which is often elevated in individuals with chronic pain. Mindfulness-based programs for chronic pain. Several structured mindfulness programs have been developed specifically to help individuals manage chronic pain. The most widely researched is Mindfulness-Based Stress Reduction, MBSR, an 8-week program developed by Dr. John Kabat-Zinn in the 1970s. MBSR combines mindfulness meditation, body awareness, and gentle yoga, encouraging participants to pay attention to their thoughts, emotions, and physical sensations without judgment. Clinical trials have shown that MBSR can lead to significant improvements in both pain intensity and quality of life for individuals suffering from various chronic pain conditions, including back pain, arthritis, and fibromyalgia. One of the key mechanisms of MBSR's effectiveness is that it changes the way people perceive their pain, reducing their emotional reactivity and helping them to cope more effectively. Mindfulness-Based Cognitive Therapy (MBCT) is another effective approach. MBCT integrates mindfulness meditation with principles from cognitive behavioral therapy (CBT), which targets negative thinking patterns that can contribute to emotional distress and pain perception. MBCT has been shown to reduce the risk of relapse into depression in individuals with chronic pain and is particularly useful for those whose pain is accompanied by anxiety or depression. The role of self-compassion in chronic pain management. An often overlooked aspect of mindfulness is its emphasis on self-compassion. Chronic pain can lead to feelings of frustration, guilt, or even self-blame as individuals struggle to understand why they are in pain or why traditional treatments have failed. Over time, this emotional burden can deepen the experience of pain, creating a sense of helplessness and isolation. Mindfulness fosters self-compassion by encouraging individuals to treat themselves with kindness and understanding. Instead of judging themselves for their pain or struggling to fix it, mindfulness encourages patients to accept their condition as part of their current experience without attaching negative judgments, incorporating mindfulness into everyday life. While formal mindfulness meditation practices are beneficial, integrating mindfulness into daily life can also have profound effects on pain management. Simple practices like mindful breathing, where individuals focus on their breath and gently bring their attention back to it whenever their mind wanders, can be done at any moment during the day. This can be especially useful during episodes of pain, helping individuals ground themselves and prevent spiraling into negative thinking patterns. Body scan meditation, where attention is directed to different parts of the body in a systematic way, is another effective tool. This practice helps individuals develop a heightened awareness of bodily sensations without becoming overwhelmed by them. Over time, it can foster a more balanced relationship with pain, where sensations are observed without excessive emotional or mental reaction. Conclusion: mindfulness has a holistic approach to chronic pain relief. Mindfulness offers a powerful and holistic approach to chronic pain management. By teaching individuals to focus on the present moment and accept their experience without judgment, mindfulness helps break the cycle of pain, catastrophizing, and emotional distress. While it may not eliminate pain altogether, mindfulness transforms the way pain is experienced, providing long-lasting relief that complements traditional medical treatments. In addition to its direct effects on pain perception, mindfulness fosters emotional well-being, reduces stress, and promotes self-compassion, all of which are essential for coping with chronic pain. Whether through structured programs like MBSR or informal practices integrated into daily life, mindfulness provides individuals with the tools to regain control over their pain and improve their overall quality of life. Thanks for watching. Don't forget to like and subscribe to our YouTube channel.